All right, we've been discussing this on the show today. The measles situation seems to be getting worse by the day. In fact, the CDC is saying the outbreak could become endemic without vaccinations.
Dr. Carm Sebastian is here now to sort through the myths and get to the real facts of what you need to know to protect your child and your family. Dr. Carm, great to have you here. Really important topic. This was a disease that was eradicated, wasn't it?
Yes, it was eradicated in 2000.
Why is it back, and how did this happen?
Well, it's back because of a couple of reasons. First of all, people got very comfortable thinking that, you know, okay, it's gone. I don't have to worry about vaccinating anymore. But one of the things we've seen, especially from this California situation, is that...
California that has now spread to 14 other states.
Right, but where did it come from? It came from outside the United States. So somebody in the Philippines who was not vaccinated, who did have the disease, came to California, and that's where it started.
Now let's talk about the vaccination, because there are some people, either because of political reasons, they're conservatives, they don't want to listen to what the government tells them to do, or religious reasons, they don't want to vaccinate.
Right.
Allay their fears about the vaccination. Some people think it's not safe, too.
The vaccine has been, it's one of the safest vaccines we have. It's been around for almost 50 years. It has very, very, very few complications. In fact, any kind of negative complication is probably 1 in a million. So this is a very safe. It never had thimerosal. It doesn't ever have mercury in it. It's a very safe way to vaccinate.
And is it just one needle? And at what age should your child be getting vaccinated?
No, it's actually 2. They started with 1, and they found you could get up to 80% immunity. And if you add the second one, you can get around 90 to 100% immunity. So the first one's given between around 12 to 15 months of age. And the second one is right before you go into school in kindergarten, 4 to 6 years of age.
And Dr. Carm, you know, there are a lot of pediatricians now that will not see any children that have not been vaccinated for this or for anything else, frankly, at this point. What do you feel about that as a doctor?
I think that, you know, our first response is to protect the patients that we care for. And I certainly understand if you have a child under 12 to 15 months of age in your practice and they're coming into your office and they're next to someone who's not been vaccinated and now has the illness, that baby can die. So I totally understand it.
So if you were a pediatrician, would you turn away children that were not
if I
vaccinated?
could not separate them in the office in a way that would be safe for everyone, I think I would have to.
Can you get vaccinated at any age? Say
you can.
Say your parents said, okay, well, it didn't happen when you were a baby, but now that I see how dangerous this is.
Exactly. And in fact, you know, complications happen more in those under the 12 months of age and over 20 years old. So it's better. If you're over 20 and you've never been vaccinated, you should get vaccinated.
What are the symptoms when you have the measles?
Well, you know, it starts off like a really bad cold. There's the coughing, which is the mode of contagion, so that's the transportation, but there's the coughing, there's the eyes watering, you know, you feel really crappy, but then about 4 to 5 days into it, you start getting the rash up along the hairline, the face.
So it's mostly the face?
Well, then it travels down the body. The rash travels down the body, so the red spots, you get some spots in the back of your, and then you get a fever up to 104.
How easy is it to treat this?
There is really no treatment for this. There's no antiviral. So there's no, it's not like, you know, with HIV and other viruses, we have some antivirals. Even with the cold, you know, the common cold or the flu, you have Tamiflu. Not with this. We don't have anything, so it's just conservative.
But we should point out that it is very rare that someone dies from the measles, correct?
It is very rare. The complications that we watch out for are the complications of the babies getting pneumonia from getting measles, and that is the #1 reason why babies will die from measles is pneumonia. The second one is the encephalitis or the inflammation in the brain, and that is incredibly lethal. But it only happens about 1 in 1,000.
Where do you see this measles outbreak going? Do you think it's going to be contained?
Well, you know, the problem is that we have some states that really have not had the immunization level, or what we call the herd immunity. So their immunization is not up past 90. In Florida here, we're pretty good because we are up past 90, but I think that there's going to be more spread in those 14 states.
Oh, gee. Okay. Dr. Carm,
all right.
good stuff.
Very important information.
Get vaccinated. fascinated.
much.
Thank
Yeah,
you.
definitely
Thank
get
you.
vaccinated.
Thank
All right,
you.
we'll be right back.